Old Guy Talks is all about creating a kick-ass life for yourself and those that you love. Don't wait, don't hesitate, don't procrastinate. Opt in now. This content is copyrighted by oldguytalks.com. All rights are reserved. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You are responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You may have different results. This is Orson, the old guy from www.oldguytalks.com, here with Dr. Jill Zdan from Innova Medical Spa in Phoenix, Arizona, folks. And I've just put it on so you can see her address and phone number to where you can find her. Today we're going to be talking about prostate issues and stem cells and a whole bunch of other things. But just to let you know a little bit about her, she's a naturopathic physician, and she spends a lot of time in the anti-aging space. So I think it's not called the anti-aging space, but I'm showing my age by calling it the anti-aging space. I think people are calling it now functional medicine. She's an expert in stem cells, platelet-rich plasma, all sorts of regenerative therapies, all stuff to slow the aging process. And she does treat also acute illnesses and other issues such as high blood pressure, hormone imbalances, both for men and women. We were just talking about that off camera as we were doing that. But before I get started, I have to keep Sue, the IP lawyer babe, and she knows I refer to. She knows I refer to who before you say he's a misogynist. She knows I refer to her like that, and she also laughs and she says, "Go ahead." And this is not the way Sue would write it, but this is the way but she said this will work just fine. This is information only. Consult with an appropriate professional before starting any program. Do not be stupid. You're responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. You can rest assured the old guy only promotes stuff he uses. You will have different results because we're all different. It's not may, you will have different results. All right, Jill, now we got that bit of legalese done and everything else, and try to keep the lawyers away from us to a certain extent. Let's give us an overview of the type of stem cell therapies or type of stem cells that are out there, and at the same time, what are they used for? What kind of things can you treat with them?
Okay, so starting with the types of stem cell therapies that are out there, kind of falls into two classes. So you have transplants, which is usually a bone marrow harvest or a fat harvest from your own body that then gets processed and re-injected into the area that needs to have that repair or regeneration. And then there's that we call the allograft category. So this is a tissue from another human, usually from umbilical cord, or I shouldn't say from a human, but usually from part of donated placenta or umbilical cord. It's from a healthy C-section pregnancy. So you can use that umbilical cord tissue, the inside of the placenta, the amniotic side. And then they're even getting as small, have you heard of exosomes at all? This is kind of some of the newer technology. They're really little lipid vesicles that are from every cell in your body. It makes exosomes. And they're concentrating them down. And it's really triggering your own stem cells to work as if you're much younger. And it draws in all the healing repair to the area. So pros and, go ahead. You have a question?
Okay, I'm sorry. Go ahead. Go ahead.
Oh, no.
No, you're...
So pros and cons, right? With a transplant, it's a surgical procedure. There is a higher risk of infection. There's more downtime, and the recovery time takes longer because you're actually extracting something. It tends to be a little more inflammatory, more painful process. But with the allograft, they're sterile, easily injectable. They're flowable right through a syringe, and it's a much simpler procedure for the patient overall. And we're seeing excellent results with both. But, you know, they're always going to be, it's kind of like, you know, the camp of, nope, I'm only do stem cell transplants, into the camp of, I did great with that allograft and it's easier and simpler, I'm just going to do that again. So it's one of those things, you're either, you know, on one side of the bus or the other.
Okay. Tell us a little bit more about that. The new one that you said is the
Sure.
What's it called?
Exosomes, yeah, exosomes, EXOSOMES.
Okay.
And yeah, they've really just, because what happens is, they first started with the full allograft, which when you take that tissue from either umbilical cord or the amniotic tissue, and of course, it's rich in stem cells at the time of harvest. And then they process it. Of course, the stem cells don't last, but they release all their contents, which are cytokines, growth factors, and exosomes. All these things that call in your own immune system and activate your own stem cell processes. So now they've, been getting creative and just creating formulas that have exosomes. And they're getting great results with that as well. So it's not just so much the stem cells, what they contain and what they can trigger your body. Those chemicals can trigger your body to do. Mm-hmm. And in terms of your other question, in terms of what it can be used for, it seems like at this point almost anything. Anything from aesthetics, hair restoration. Women are using it all the time. Well, men too, on their skin, for anti-aging effects. And there's always joint health, ligament health, tendon health, greatly strengthens those tissues. Sexual function, either with the P-Shot, the O-Shot, or the prostate injection for prostate health. I'm really excited. I just did this respiratory allograft treatment. So, are you familiar with what a nebulizer is?
Sure, yeah.
Where it vaporizes a liquid medication. So
yeah.
I've nebulized Allograft. And I never had allergies in my life until I moved to Arizona. And all the tropical plants are horrible. It like clockwork. On February 1st, every year, I start having horrible runny nose, sneezing, horrible sinus pain, and then I also have allergic asthma attacks. And so 2 weeks ago, I nebulized stem cell, the allograft, the biologic allograft. I haven't had a single asthma attack, and I maybe sneeze, runny nose a little bit, a couple times a day, but this has been life-changing. Like, I can actually go outside. I can enjoy my day in this time of year where normally I just stay inside and suffer and I'm on antihistamines normally the whole time. So for respiratory health, I think that's an extremely exciting treatment. Asthma, allergies.
Yeah, not to get sidetracked here, but
yeah.
Before everyone moved to Phoenix,
right?
it used to be the place to go for allergies.
Yes, the irony.
The irony. I mean, it used to be like it was dry, but now with everyone that has a lawn and between that and the blacktop effect in the summer and the humidity, it's really, really high. It's noticeably different actually in Las Vegas. It's kind of funny from that regard, but. So you're using it for a lot of different things. I know that
everything.
I've had some friends that have had treatment there, and they've used it. Actually, have very successful combination of the stem cells to basically treat their knees with a combination of stem cells and platelet-rich plasma, and they're very very happy with the results. Actually, one in particular. I know that Carmen, who practices with you at Nova, he had one that had knee surgery that did not turn out so well, and the other knee, Dr. Carmen Mora, had treated with stem cells and PRP, and that was proved to work out pretty well. It required a couple of treatments in his part.
Sometimes it takes a few, but
but he's a lot better, and now they're trying to rehabilitate the one that had surgery. The one that had surgery. And then another friend of mine that was treated there, actually about 3 months after he got treated there, he climbed Mount Kilimanjaro.
Oh yeah, I know who you're talking about. Yeah.
So it was just pretty amazing. So let's talk about the uses of stem cells, and you can tell us what kind you find that are most useful for treating prostates, because I think a lot of people, until you get into this area of prostate damaged or hyperplasia, hyperplastic prostate, or whether that's grown or maybe damaged after a prostate biopsy or partial prostatectomy. It's a big issue and affects men and their relationships in a significant way. One of the things is that if you had a total prostate removal, basically there really is not an opportunity for regeneration, because there's nothing there to regenerate. And it's the whole concept of having a dry orgasm and things like that is just kind of it's kind of, when you read it, you kind of wonder, like, oh gosh, that doesn't sound like a lot of fun. But let's take a little nicer note and not go down that particular path. Let's talk about what kind of things that you found have been successful in treating prostate issues, and what kind of things do you do, and then we'll talk about then we can kind of get more into the whole thing about ejaculation and things like that.
Yeah. So the first step is always important in terms of, the man's got to go to a urologist and find out, because, first thing that happens, right, is your PSA is high. So you're going to lab the result back, PSA is high, go to the urologist, and you need to know whether it's benign prostatic hypertrophy, BPH, or whether it's some form of prostatitis, or whether, you're looking like there could be cancer. So we just have to get that all sorted out. If it's BPH or a chronic prostatitis, you don't want to inject with an acutely inflamed, irritated prostate. You want to let that, treat that antimicrobially, and get that under control, and then you could move on to some kind of stem cell therapy. But if you're talking about BPH, chronic prostatitis, or as you were mentioning too, if someone had part of their prostate removed, there's some scar tissue in there, things just aren't working like they used to be, then that's a perfectly acceptable time to use a stem cell therapy. We tend to use Biologic Allograft, which is the full kind of soup from the umbilical cord or placenta. So it get everything. You're getting some exosomes, you're getting some cytokines, you're getting tons of growth factors. And it's a pretty simple procedure. It's unfortunately not the most comfortable one, but it's very quick. And really, I guess, to be most accurate, it is not a true prostate injection, because it's not using some kind of guidance to make sure that you're injecting into it. It's really a transperineal. So you're going in that perineal area, kind of between the back of the scrotal sac and where the anus starts, and injecting in there, because it will diffuse to where it needs to go. That's the beautiful thing about these allografts. There's so many chemical messengers in there that they pick up on and almost act like magnets to damage tissue. So they know where to go. And that's really the beautiful thing. We've seen PSAs come down from 20 down to 3. Sometimes it's not always that dramatic. Sometimes it's just 20 down to 10, but their urinary symptoms are gone. They don't have to get up 8 times a night to urinate, which is a big improvement in quality of life.
Sure. And
also, again, with the sexual health. So that, of course, makes a huge difference in terms of, sometimes it takes just a little bit longer. It's not a fast response. A lot of times we like to combine it with the pulse. You're familiar with the pulse wave therapy, the shockwave therapy?
Yes, I am.
Okay. Okay. So that's another great one for prostate health and male health, erectile dysfunction. We do combine those two a lot, because it helps helps bring new blood vessel growth to the area and everything to regenerate more quickly. So it's kind of like the 1-2 punch. But it is kind of a tricky thing especially if you've had a full prostatectomy. There are people that we haven't been able to help, where it's, we kind of tell them that up front, let's, see how this goes. Of course, with any treatment, even if it's a 90% success rate, there's still 10% of people it's not going to work for.
Sure.
So it's just kind of one of those scenarios, and we're very honest and open with the patients up front.
Okay. So we're going to delve into here an area that there's not a lot of science on it, and so a lot of men that have had partial prostatectomies, or had maybe some nerve damage from a prostate biopsy, or some residual, or BPH. What's been the kind of the findings, or your experience with improving ejaculation? Because a lot of times what happens is that their ejaculation is actually significantly affected. And,
right.
Yeah. So have you had any experience in that area, or?
Yeah, I would say between 65 to 70% of people get good results and are able to regain about at least 80% of where they were before the surgery. Is what I've seen so far.
Okay. Yeah. All right. Well, that's actually pretty promising, and with that, because like I said, a lot of times there really is not a lot of before this, there was actually nothing that could be done.
Right. Yeah. And I know the urologists, I think the first thing they do after part of the prostate's removed, they always tell you, they give you a pump and they're like, make sure you're using this every day, because if you don't use it, you're going to lose it. And, a lot of times it is really helpful if they do that diligently after the surgery, because it's just bringing blood to the area, activating those nerves, and then kind of like a normal process, even if it's not easy to attain that erection without the pump.
Yeah.
It does help as well.
I know they recommend actually having sex as as much as possible, which is
there's a prescription for you.
Yeah, that one will be real popular. Yeah. So now for you, how would you? There are probably very many vendors in the stem cell area.
Yes.
Okay. And for a layperson, and why don't you explain what the process is that you go through to evaluate the quality of a particular particular set of stem cells, and how can a patient figure that out when they are seeing a doctor about stem cell therapy?
That's kind of a tough question in terms of how a patient would figure it out. I mean, really, they'd have to sit down, schedule a little consult with a doctor, say, hey, where are you sourcing your allograft from? Have you checked them out? Things like that. You'd have to probably have that kind of just a frank, honest discussion. We source ours from two places. One comes from the Utah Cord Bank, and that's our umbilical derived. And Utah Cord Bank is really well known for quality and excellent preservation of the tissue. So that was one reason we've had great results with their product. Our other one here is actually local. It was Biolab Sciences. And with them, I actually went in and spoke with their scientist on site and, asked all my questions about how it's made, how it's sterilized, things like that. Then, of course, the real litmus test is, do they actually respond well? And we've had such a great result with it that I know that they're good products.
Okay, and they also do the umbilical cord?
The Biolabs does strictly the amniotic, the placental.
Okay, so the amniotic, and the other one does an umbilical cord. Yeah. Okay, all right. Yeah, because I think a lot of times, when you're a patient, you don't really know, you can't really, you have a hard time figuring it out.
Oh, sure. And there's so many companies now, making these allografts that's a great question.
Well, I'm glad you mentioned too. Obviously, we don't want to get sued, so we won't mention the ones that you think are bad.
Right. Yeah, exactly. No slander here.
Yeah, nothing here. But folks, the two ones that were good. I'm going to write these down in the notes here. Which one? They were Utah
Cord Bank. Yep. And of course, there are a bunch of different distributors, sourcing from Utah Cord Bank. But
okay.
Yep.
And then let me just get that on here. So everybody's got that, and you can see that. And then the other one is was called Biological.
Yeah, so Biolab, one word, Biolab Sciences, and they're locally right here in Scottsdale, which is really nice.
Okay, and so now we got Biolab Sciences. So So Jill, if somebody wanted to find you, how would they find you?
It's easy. I work at Innova Medical and Spa in Phoenix. Phone number is 602-973-1774. If someone's interested or just wants to know more, we do offer free 15-minute consults just to discuss, what their problems is, whether it's a good fit, what treatment might work best for them.
Wow, that's pretty nice. That's a pretty good deal.
Yeah.
That's a smoking deal. That's a smoking deal. And so, folks, there's the website, Innova Dental Spa, and you can contact them and make an appointment and see them. I have done so, and I think I'm a frequent flyer there.
Yeah, we always like seeing you.
Well, excuse me. I want to thank you very much for coming on the program and talking to us about this.
Thanks for having me.
This is until I got into investigating this, I did not realize how traumatic, how traumatic of an experience this is for men, and how it affects their relationships. And it affects both the man and the woman if they're in a heterosexual relationship, and obviously if it's a gay relationship, it's both of them. But it really it impacts people in a very significant way, and it really alters the quality of their life in not a good way when they suffer from this. And it's nice to know that there's ways to treat it. So. All right. So I want to thank you again. This is Oris, the old guy from www.oldguytalks.com. If you have not already opted in, what are you waiting for? Is this and other life-altering material that we have on the site? And, it's all about creating a kick-ass life for yourself and those that you love. Take care. If you are interested in creating a kick-ass life for yourself and those that you love, then become a member at oldguytalks.com and get access to the cave area, where not only do I have my interviews with doctors on cutting-edge therapies for erectile dysfunction, but I will have other things that are posted in there that will help you create that kick-ass life that you want for yourself and others. And we're going to be talking a lot about different kinds of vices and virtues. So opt in and become a member